My name is Dr. Robert Odell. The purpose of this video is to demonstrate for the viewer the neuropathy blocks that we do at this clinic. We use a combination of local anesthetic and advanced electromedical device in order to reverse the symptoms of neuropathy. This is done at no risk to the patient. We've developed this over the last 5 years. We do an injection of Marcaine, a low dose, low volume. We actually inject the posterior tibial nerve, which is right here, this yellow structure. We inject it usually a couple centimeters above the medial malleolus. With the same injection site, we go anterior to the saphenous nerve. We then take the needle out of the skin. We put the needle in just lateral to the extensor hallucis longus into the deep perineal nerve, which is about a centimeter or so below the skin. We then bring the needle out without going past the skin and move laterally, and we get the two strands of the superficial perineal nerve. The one more injection is between the Achilles tendon and the muscle here. We inject 1 cc where we can catch the sural nerve. We usually inject about 8 cc's of 0.25% Marcaine, which is a very low dose. A surgical block would be 20 cc's of 0.5%. So we're using about a quarter of the molecules. The reason for this is that there are certain characteristics of the local block that not only refer to its ability to block the sodium channels, but also the cyclic AMP is released with this, works with the electromedical device to affect the results that we get for neuropathy. We are basically treating a chronic disease with acute means. This is done over time. I'd like to demonstrate the block now on a patient. Now, my patient Bill has graciously consented to being photographed. He has a pre-diabetic or idiopathic neuropathy. We're going to start the injection with the sural nerve on the left foot, right here between the peroneus muscle and the Achilles tendon. I'm injecting 1 cc of local anesthetic. I'm now injecting the deep perineal nerve, just lateral to the extensor hallucis longus, about 1 centimeter below the skin. I'm now going to inject the superficial perineal nerve without taking the needle out of the skin. There's 2 strands as I showed in the model, and I'm injecting it right there. Now we turn to the posterior tibial nerve, which is 1 finger breadth. It goes north toward the body, toward the head, just behind the medial malleus, about 1 finger breadth. And that's pretty constant if you look at the model. So what I do here is I use my finger, I'm going parallel to the leg, and I inject here. Now, if I do touch the nerve, the posterior tibial nerve, the patient gets a paresthesia. It turns out that they will not have any long-term or even short-term effects. These injections in the leg are very, very forgiving, which is very fortunate because I've dinged the posterior tibial nerve in the same patient the same day. If I'm doing a block in the back, very often, maybe 20%, 15% of the time, you touch the spinal nerve. And what will happen is the patient will have pain. Usually it goes away in a day or so. However, I've had one patient that had it for 3 months. Fortunately, he did not come back for 3 months, and then it was gone. But the more proximal nerves are way less forgiving. The median nerve, when we have to do blocks for neuropathy in the hand, which is not that often, usually these respond just to the machine treatments. When we do the median nerve, if you touch the median nerve, the thenar eminence can often hurt for a week, and that scares me a little bit. But in the feet, it's great. Mid-levels, a nurse practitioner and a physician's assistant who work with me, Monty Carey and Barbara Shinko, do these blocks routinely. They're very, very safe to do. In fact, general practitioners could do these as well. We're now going to do the right foot coming from my right to left. Here's my finger. This is where the nerve is, posterior tibial nerve. I'm going down a little distance. I'm injecting 2 cc's. I now withdraw, not outside of the skin. I'm injecting the saphenous nerve, which is sensory to approximately this part of the foot, although there's a variation. We're going to continue. Again, this is the EHL extensor hallucis longus. I can feel it right there, right here, just lateral to it. I go down about 1 centimeter, and that's the deep perineal nerve, which innervates this area. And then 2 cc's of 1/4% Marcaine is now injected laterally where the 2 strands of the superficial perineal nerve are. The final nerve, again, is the sural nerve, and I'm injecting it just under the skin, 1 cc. This was taught to me by a podiatrist in New Jersey. That's all you really need. Now, the sural nerve is sensory kind of in this area. And again, there's variation. So in that way, we use 1/4% Marcaine. We use about 8 cc's, maybe a few more cc's in larger people, and we cover the foot with enough molecules to work in conjunction with the electromedical device to get the results that we're getting with this neuropathy treatment. If you have any questions, please do not hesitate to call the clinic, 702-257-7246, or my cell is 702-521-9542. And thank you very much.